Good afternoon. My name is Steve Rosenthal. I am the CEO of Triton Benefits. We are a benefit HR company, and we have some exciting news to share with you today on this PowerPoint, RX claims data, what your HR and benefit team needs to know. During the presentation, I may be asking for a couple of poll questions just to get an idea of the audience so I could gear my presentation accordingly. During the presentation, should you have any questions, please use your panel bar and write your question down. And throughout the webinar, I will be answering some questions. Okay. With that said, if you don't mind, I want to just do a quick poll just to get an understanding on your organization in terms of insurance. Is it fully insured or self-funded? I'll just take a moment out just to see what type of medical programs the audience has. So on this, it says, is the organization fully insured or self-funded? So I guess if it's self-funded, you want to put yes, fully insured, no. Okay. Great, I'm just going to close that poll. And one more quick question. And here we're trying to find out, over the years, has your broker or insurance carrier asked you for claims data? Sometimes that's difficult to get, based on the size of your group. Okay, so it looks like about half the population on this webinar has the ability to get some type of claim data. Others can't. And that's what this program is all about, how to be able to collect data, not always doing it the conventional way, but doing it other ways as well. So let me close this poll. Okay, and let's start the presentation. So what is IntelliScript? IntelliScript enables health plans to make risk assessment decisions with confidence. They combine the value of prescription histories with the power of predictive modeling to bring medical information to group underwriting. This enables health insurers to quote groups quickly and more accurately in order to win the right business at the right rates. Now, who is allowed to collect such sensitive data? You talk about HIPAA. Everything is always about HIPAA. You can't have this information. Believe it or not, there's the largest actuarial firm in the country called Milliman. Google them up. They're huge. They're publicly held, and they gather the data in an aggregate form, not by individual. So when you want this information, and a lot of the prescription information is available, through public records, they can get this information, but again, not by a group's individual, but by the group in totality. Up until now, especially if you're a company under 100 employees, getting claim information has been a challenge. I know, for instance, even the Blue Cross, they want sometimes up to 200 employees to get real good claim data. Sometimes they'll just give you the MLR, the medical loss ratio, and limited data. And so it makes it hard when you're shopping your insurance or you want to go from a fully insured to a self-funded plan. Everybody wants data. So this is a new way of getting the data. A lot of carriers are doing it today. So if Curve is what Milliman has developed, it's the software that delivers the results. So the software turns the group census data into a powerful risk score. Health plans use Curve risk score to more accurately predict a group's future claims. So what does that mean? It means that in the past, getting claim data has always been important, but getting prescription data to know what type of prescriptions your group has is really what the key is. During the last 10, 20 years, things change, even with credit underwriting. It's how responsible the individual is. Even when you're going for auto insurance, how responsible that individual is. Today, in medical insurance, it's who's on the prescriptions, what kind of prescriptions are people taking. And believe it or not, you don't even need social security numbers. Typically what a broker or what the carrier is going to ask for is going to be the employee and dependent. Dependents are now very important, dependent level census to understand what their name is, Get the name, date of birth, zip code. That's it. No social security. And as everybody knows, when you go to the pharmacy, it's always about your name and your date of birth, right? So that information gets conveyed to a national directory. It is public, and Milliman's able to tap that information. So it enables carriers, enables companies to more accurately take a look at the outlook of the medical condition of the organization, more accurately quote the new business. Increase placement rate of groups, better risk profiles, and avoiding groups with poor risk profiles. So what that means is that if a group is taking a lot of meds, heavy meds, there may not be a good underwriting risk. But there's ways to improve, the group experience by having this data. Data is king. So no authorization is needed because, as I mentioned earlier, it's going after de-identified data. It's looking at the group. So if you have a group with 80 employees, 120 employees, we get the group, we get the date of birth, we get the zip code, get the names, and within 30 minutes, that information is compiled and it's able to create this score. And it is shown to deliver predictive power to a great extent. A lot of the underwriters are using this today. And it's a tremendous return on investment as a result, because to use this service or to buy the data is very inexpensive. But to know what type of group you have when you're talking about medical insurance, your largest expenses, it's vital. So Milliman's approach, they've created an automated underwriting engine, and it enables insurers to perform quality real-time risk assessment on individual insurance applicants. The system interprets the data, prescription data, and so what I meant before about national databases is the Medical Information Bureau and MVR data to identify potential conditions, including severity, so insurers can make better decisions quicker. The system can be easily tailored to address each insurer's unique underwriting guidelines. This new use of data enables more consistent and efficient underwriting and improves the insurer's business performance. It's fully transparent. Interpret the electronic data to determine the applicant's health status, identifies medical adherence issues, drug combination, opioid abuse, and many other complex prescriptions and medical data that are driving up costs, and in many cases, driving down costs if it's favorable. And decisions are driven by mortality evidence, but this enables underwriters to come up with instant decisions. So if someone's on high-cost combination meds, compound meds, a lot of times a group will start out based on manual rates. So if you don't have good 12 rolling months of claim experience, an underwriter for a group over 100 is going to give the manual rates. That's your census. It's based on population, age, demographics of the group. And then based on how the Milliman study and the score comes out on the curve, that manual rate can go up 10, 20, 30 points. It can go down 10, 20, 30 points. So that's how it's done on a manual basis. So how are insurance companies delivering this? Aetna is delivering this in a product called AFA. It stands for Alternative Funding Arrangements. Aetna today, in the past, has delivered this product for groups up to 50 employees, 5 to 50. And now they're doing it in another segment, 50 to 100 and 100 to 300. United Healthcare has a program called All Savers. Same thing. You don't need questionnaires. If you don't have claim experience, there's now a new way. It's called Curve, getting the data from the RX Bureau. Blue Cross has their model. It's called ASO. And Cigna has their model. It's called Funding Solutions. All of these carriers, they deliver this in a self-funded model called level funded. So the data can be used on a large self-insured group in addition to claims experience. No claim experience, this becomes vital, and now a carrier can make decisions based on the RX data. When it comes back favorable, the rates are very attractive. Triton Benefits, we manage over $400 million in annual premium. And I can't tell you how many policies we're writing today that have some type of self-funded or level-funded component. And it makes all the sense in the world for a number of reasons that I'll get into in a little while. When the RX data is not favorable, you have data. You now know what you can do with your group. So we can mitigate this. If this is a group that is 102, 103, 105 employees, and we know the score comes back really bad. One, method may be, let's try to keep that group down in size a little bit. Maybe the group needs to be at 99, 98 for a period of time. Let's say if you're in New York, anything under 100 is basically community rated. 100 employees are community rated. So maybe it makes sense, now that you're holding the cards, you're holding the deck, does it make sense to go into a community rated plan? Right? If you have good data, then, hey, this is a great way to go, whether you want to do level funded or self-funded. But today, all the carriers are starting to use this type of millimeter approach. I want to take a moment to see if we have any questions. Cindy from Oklahoma writes, what happens if the data comes back poor? So when the data comes back poor, Cindy, a lot of times the carrier will punt and they'll say this isn't a good group for us. Many times they'll come back and they'll go with a little higher rate, but that higher rate still may be better than a fully insured rate. I mean, I've seen some companies out there paying for single coverage for basic $1,500 deductible PPO type of plan for an individual, $800-900, and families I've seen up to $3,500 a month. So, it's all relative. What are you paying versus paying for manual rates with a 10 or 20% uptick based on the evidence. That's a good question. Close out the questions for now. Let me keep going. The advantages of level funded plans. So when you have these type of programs, these type of ways to get data, if you keep it inside a fully experienced group, it's not going to help anyone but the carrier. You have this data, you can now go into level funded type of plans, self-funded type of plans. So built into these premiums are specific stop loss insurance, aggregate stop loss insurance, claim fund, and admin cost. In month 15 of the plan year, any surplus in the claims fund, it's returned. So some companies, some carriers will do 50 to 100% return, anything that's left in the surplus. And sometimes they'll do it as a check or an admin credit. It all depends which carrier and how your broker negotiates this. Stop loss protection against unexpected claims. So the reason why I'm getting into this a little bit, this all works hand in hand, with having the RX data and the use. And you want to have some type of self-funded or level-funded plan. And this works really well with the carriers I mentioned. They've been doing it in the form of level funded. So shock loss may be defined as abnormally large and unexpected claim. Could be the result of a severe accident, serious illness. Level funded usually builds in stop loss coverage of $25,000 to $50,000, depending on the size of the group. So insurance companies are prepared for such occurrence. They build stop loss into premium to help offset the financial impact shock loss can cause. This is called pooling costs. So stop loss coverage is delivered within a level funded program. How can a level funded program protect itself from large claims and avoid large rate increases in the future? Stop loss insurance is designed to offer effective protection against excessive claims by limiting the amount of risk on any individual insured. Self-funded, 100% of covered losses you pay for any individual in excess of the individual policy year. Deductible will be reimbursed for the remainder of the year. So in level funded, you're not laying money out. So in other words, if you have, let's say, a specific stop loss level set at 25,000 or 50,000, once someone goes over that, a lot of times self-funded, you continue to pay, you get reimbursed at the end of the year unless you have something called an accommodation built into your program. Whereas in these level funded plans, you're not laying out the money and waiting for reimbursement for claims over that stop loss limit. So aggregate protection, this is the aggregate stop loss, it's the ultimate protection. The expected claims, any given group can usually be predicted with a fair amount of accuracy and thus can be budgeted. The impact of any unpredictable fluctuation can jeopardize the financial stability of a company. So the aggregate stop loss is a precautionary measure designed to protect you from the unknown, guarding your assets and preserving cash flow. Aggregate stop loss is based on the total claims of the group. The aggregate insurance covers you should the overall claims be greater than what the underwriter determines. So here's a great example on how these level funded plans work, again, by utilizing the data. In this case, here's 3 different plans. Here is a AFA Choice POS 1500 plan. And the one next to it is a 2750 deductible plan. And then the last one is an HSA plan. And how the carriers charge, this group has, looks like 10 employees in this group. So there's a service fee, there's stop loss, there's aggregate factor that's put in, and terminal reserve. So anything that comes in less than the aggregate factor in month, typically it's 3 to 6 months after the plan year closes, you get that money back. Right? So as you can see, if we look at all these plans, the annual cost is $198,000. But out of that $198,000, there's $93,381. Claims go under that, carrier writes you a check. It's as simple as that. And so if you have a good risk portfolio as it relates to using this methodology where we're able to take a look at the experience, this is a great move for you because you have an opportunity to get money back. What type of plan designs are available for my employees? All different types of plan designs. In this case, these are all network and non-network. The plans I just mentioned have, the first one has a $1,500 deductible. The next one has a $2,750 deductible. And the third plan also $2,750 deductible. But you could change the co-insurances and some of the components within the plan design. So the advantage of these programs: flexibility in plan design, self-funded plan, but you're not bound by the state mandates. So there's a lot of savings when you can do these type of things. Risk management effectiveness through stop loss insurance. The employer may choose the amount of risk to retain and the amount to be covered under the stop loss protection in traditional self-loss, but in a level funded, the amount is set by the carrier. Level funded and self-funded plans both deliver claim data that can be used with analytics to help measure your plan's performance and make corrections to improve the financial health of your group. So there's tax savings. So there's no premium tax or self-funded claim fund, so you get immediate savings from that part alone. Assuming the annual premium is $626,000, 2%, there's $12,500 in potential savings for you by not being in your traditional fully insured plan. The Affordable Care Act has some surcharges. The health subsidy fund that also gets eliminated. So greater control, less margin for the carriers, which is good, more control for the employer, and longer term strategy to control premium costs. So when you're using this type of data and you're able to know what you're going into, there's a greater chance that you can get some money back. So at this time, I'd like to see any questions for the group. Please feel free to type them in. Just give it another minute for some questions. Will we receive a copy of this presentation? Absolutely. So once this downloads, we will make it available on our website. Should be by Monday morning. How can I learn more about this for my company? So what I always recommend, we're one of the largest brokers and producers in the country today, and we sell a lot of these programs. We manage well over $400 million in annual premium. So I would certainly, give us a call. We'd be more than happy to do a consultation. talk to you a little bit about these programs and to see if you qualify for these programs as well. That was from Gail from Minnesota. So thank you. Okay, so Aaron writes, too risky. Will that prevent, trying to read this here, will that prevent care and medicine? Not really. I mean, if you're accepted into the program, this is going to cover everything. It's no different than regular insurance, except you're going to have a little bit more control. You're getting good data, you get good claim reports, and with these reports, you can manage your business a lot more efficiently. So it says, what kind of information do you need to collect this, see if they qualify? So typically what we want to get is a dependent level census. It'll have your traditional name, address, zip code, spouse, children. So we want to put that into the census. And then from that, we can go in and see if you qualify. And I think that's about it. So I know we covered a lot of ground quickly. I appreciate you taking the time and listening and learning about this program. I want to thank you and enjoy your weekend.